House Democrats are holding a hearing right now on Capitol Hill to address the nationwide baby formula shortage. The FDA commissioner is expected to face some tough questions over whether the agency acted soon enough to address reports of contamination at an Abbott nutrition plant, resulting in illness and death. Let's get more now from our congressional correspondent Kilmeny Dukart, joining us live from Capitol Hill. Kilmeny, good morning.
Good morning, Emma. That House Appropriations Subcommittee hearing is now underway on the Food and Drug Administration's fiscal budget for the year 2023. Abbott and the FDA will both be under the microscope here. The FDA Commissioner Robert Califf will be fielding questions from lawmakers about the delay between the FDA's September report and the June recall. Abbott representatives will also be there.
I recently released a whistleblower report which highlighted a damning list of allegations of wrongdoing at the Abbott nutrition factory that was producing the formula. Recalls happen, but this company has lied, it's cut corners, it falsified records to cover up misdoings at the sake of infant health. That's wrong.
The House Appropriations Committee Chairwoman Rosa DeLauro sent this letter to the FDA requesting an investigation into that 4-month window between the report and the recall where 4 infants were hospitalized and 2 babies died. While the FDA has the power to persuade, it does not have the power to recall, and many lawmakers are demanding accountability.
I think that when all of this is done, I'm not associating my colleagues with what I'm going to say right now. I'm just saying it myself. I think there might be a need for indictment.
The FDA commissioner has acknowledged that these inspections are underfunded and understaffed. The chairwoman, Rosa DeLauro, said that there's only 9 inspectors currently investigating these plants. She's put out legislation calling for $28 million in emergency funding to ramp up inspections domestically and internationally.
All right, Kilmeny Dukart with the latest there. Kilmeny, thank you. Joining us now to discuss is a pediatrician at Akron Children's Hospital in Ohio, Dr. Sarah Adams. Dr. Adams, thank you for coming on today. What are you seeing at your hospital? Are there parents who are struggling to find formula?
We are seeing the formula shortage and the effect that it's having on the babies. And we're working hard in our practice and with other community foundations, local charities to try to help parents as much as we can.
Sure. And we know parents just want the best for their young ones, especially during this time in their lives. You know, they're so little, they need your help and your assistance, and they need to be fed. We know not all moms are able to breastfeed. Tell me about sort of maybe the misconceptions people have online when they say, oh, just, breastfeed your child.
You're right. Not everyone can breastfeed. Certainly, I'm going to encourage everyone in the beginning mothers to try, but there's a lot of stigmata in the pressure if you're not able to breastfeed. And we're so fortunate to have formulas that are as close to breast milk as we possibly can. But the shortage has certainly created a lot of stress for moms and families across the country.
Yeah, I've heard of parents who have friends or family members who say, hey, I see some formula on the shelves. Let me grab that for you, just so you've got some available for you at home. That leads me to my next question. There has also been some talk online, perhaps, of parents trying to make their own formula. What would you tell those sort of folks who are considering that?
So I've even had some of my patients ask and show me some formulas. It was interesting. The other day, one had a recipe for homemade formula that was from 1950. I want to caution everybody, please do not make your own formula. The American Academy of Pediatrics highly recommends that you do not make your own formula because of the imbalance of nutrition. 2 things happen. One is that it could cause an immediate problem with their tummies or an allergic reaction, or that imbalance could also cause some sort of toxicity. But what we forget is that there's long-term complications with that too, such as their growth and their development. And we might not see that immediately when you're trying a homemade formula, but you will notice it as the baby and child grows.
Yeah, some really good warnings to share with us this morning. Dr. Sarah Adams, thank you so much for coming on. And of course, we hope parents are able to get that formula soon. Thank you.
Thank you.